Good afternoon, everyone, and welcome to the Lynn Cancer Institute Zoom and Connect updates. We're trying to keep you in the know in 2023. As always, we're very grateful to have you all with us today and to learn from our esteemed speaker, Dr. Patricia Jacobs. Dr. Jacobs will be educating us today on what is symptom management, a conversation that I know that we're all curious about. At the Lynn Cancer Institute, we believe that education is such an important component of our treatment plan, so we look forward to learning today. In the interest of time, Dr. Jacobs' bio was sent to you by email. We invite you during the presentation to please take notes, and if you have a question or a comment, please put it in the chat box or in the Q&A. Dr. Jacobs will not be able to hear you or see you during her presentation, and there will be time at the end for her to address any questions. Again, we're happy to welcome you and proud to introduce Dr. Patricia Jacobs. Dr. Jacobs.
Thank you, Janet, and good afternoon, everyone. So the topic of my talk today is symptom management, which is something that I spend a lot of time doing in my role here as a physician in the classic program at LCI. This is an important topic because most all of the people who've been diagnosed with cancer or a blood disorder who come to LCI for care have some burden of symptoms. So, what is a symptom? A symptom is any feeling of illness or physical or mental change that is caused by a disease. What symptoms are common in patients with cancer? Here's a list, although not every possible symptom is listed here. In our supportive care practice, the most common symptoms we help people with are pain, anxiety, depression, lack of appetite, and fatigue. But patients will come to us for help with insomnia, weight loss, alteration in taste, diarrhea, shortness of breath, and others. It's hard enough to cope with the diagnosis, but to have to deal with symptoms like this only increases the burden for people living with cancer. This slide demonstrates that symptoms can be brought on by the cancer itself, the cancer treatment that people receive, or they can be a result of the cancer itself or the treatment. Honestly, I had one symptom in the cancer-only circle and realized that that wasn't quite accurate because sometimes cancer treatment can cause the symptom that I had in mind. So really, there are some symptoms that are caused by cancer treatments and so many that can be caused by the cancer itself or the cancer treatment. Chemotherapy can cause neuropathy where people feel numbness, tingling, pain in their hands and feet that can significantly impact their lives. Radiation can cause skin changes. Immunotherapy can cause various toxicities like diarrhea, skin rashes, and a variety of autoimmune conditions that all cause symptoms. Similarly, targeted therapies that act on mutations in cancer cells are very desirable because they often come in the form of pills that people can take at home instead of coming to the infusion room, but they also have toxicities that cause symptoms. The biggest category are the symptoms that can be caused by cancer or cancer treatment. Fatigue is one of the most common, but also loss of appetite, pain, anxiety, bowel changes, nausea and vomiting, weight loss, and insomnia. So when we go to assess symptoms and try to help reduce them for people, one of the first things that needs to be sorted out is whether the symptom is coming from the cancer treatment, or a combination of both. So symptoms are often multifactorial. On this slide, I provide a few examples to demonstrate, for instance, fatigue. When I see people who are suffering from fatigue, I explained that cancer itself can cause fatigue due to chemicals that the cancer cells themselves release into the body that make people feel like they're under the weather and tired. Cancer treatment such as radiation, chemotherapy, and immunotherapy all make people feel fatigued. People also feel tired if they've not been sleeping well, often because of anxiety or other symptoms such as pain. People get deconditioned from their cancer and their cancer treatment, and they can experience fatigue that it's caused by poor nutritional status, because of loss of appetite or mouth pain or trouble swallowing. I always assess for depressed mood as well, because depression can manifest as fatigue. So in order to help someone with their fatigue, it's important to consider all kinds of possible things that could be contributing to it. Another example is constipation. So often people with cancer, whether they're on cancer treatment or not, have very poor oral intake of food and fluids because of loss of appetite from their cancer and cancer treatment. They tend to be less physically active, and that also contributes to slowing down the bowels. Some chemotherapy medications cause constipation, and so do medications that we give for things like nausea and pain medicines, particularly opioids. They're all constipating. Loss of appetite is another symptom, and people can complain of having decreased taste from chemotherapy or radiation. Sometimes they have thrush in their mouth. Sometimes they have a decreased sense of taste, but other times the taste is altered. Often people feel like they have a metallic taste in their mouth, and that makes it unpleasant to eat. And there are things that can be done to help that, such as avoiding using metallic utensils and using plastic ones instead. Recently, an oral rinse became available that can help with metallic taste. So these are the kinds of things that we can, these are the kinds of recommendations that we can make if we know where the symptom is coming from. People can have pain with swallowing from mouth sores, inflammation in the mouth from their treatment or thrush, and all of this can make it difficult to swallow. Other people have decreased appetite because of nausea or constipation, or from medications they're taking. And once again, depression can underlie everything in patients with cancer. Loss of appetite is a very common manifestation of depression. So understanding that symptoms are often coming from many different factors help us to try to address them and make them better. How do we measure symptoms? This slide shows tools that I use in my practice to help to quantify various symptoms and to compare over time with the different interventions that we make to try to improve them. So the one on the left is, at the top of the left, is the Edmonton Symptom Assessment Scale. And it looks at 9 different symptoms: pain, tiredness, drowsiness, nausea, lack of appetite, shortness of breath, depression, anxiety, and overall well-being. And it asks people to rate how they're feeling at that particular moment when they're filling out the screener on a 0 to 10 scale, with 0 being that they're not experiencing it at all, and 10 being that it's the most severe that they can imagine. On the bottom, there's a checklist of other things that cause distress that we want to be aware of so we can try to address them. These address things like sadness, transportation problems, worries about finances, worries about feeling like a burden to family, trouble with sleep, trouble with constipation and weight. On the right is a more global assessment of distress, looking at people's overall quality of life, and also a distress thermometer that just quantitates overall distress. And these are important tools that help to monitor how well we're doing with our symptom management efforts. Why is symptom management important? The first answer is the one that I don't think anyone would argue. Symptom management improves quality of life, and that's hugely important. But there are other reasons as well. Symptom management can help people complete their treatment course. Most people who come to LCI for their care are seeking cancer-targeted treatment. They go through a lot of sacrifice of time and energy to receive these treatments, and completing the recommended courses can impact the success of that treatment. So if we can help people stay on treatment because their symptoms are better managed, then that usually contributes to success. Completing treatment is not the only goal that our patients share with us, though. Sometimes it's feeling well enough to go out to dinner or take a trip that's planned. Sometimes it's as simple as being able to sleep through the night or have enough appetite to stop losing weight. There are all types of goals that people have. One of the most rewarding goals of my work is getting to know people well enough to understand what their goals are and help them to achieve them. And symptom management is a big part of that. Also, we think about caregivers. Caring for a loved one with cancer who has a high symptom burden can be very challenging. So improving some of these symptoms not only helps the individual who's living with the cancer, but it also helps to lighten the burden on caregivers and bring more quality to their lives. Symptom management also helps people to keep working when that's their goal, and it helps them to take care of their families. So I've been talking about symptom management from my perspective as a palliative medicine physician. Palliative medicine is simply supportive care for people with serious illness. In my case, I provide supportive care for people with cancer to help reduce their symptom burden, as I'm sharing with you today. But there are other people who play an important role in managing symptoms. Obviously, the individual with cancer does a lot to try to manage their own symptoms, and their caregivers do as well. People often have a primary care physician who does their part in making recommendations to reduce symptom burden. Here at LCI, there are wonderful supportive services, social workers, programs to help people feel better as they proceed with their treatment. The oncology team is the first line of supportive symptom management in care. People should always let their oncology team know what they're experiencing. Our palliative care program offers specialty level symptom management as the backbone of our extra layer of support for people dealing with cancer. We obviously don't see every individual who comes to LCI for cancer care, but we do offer our support to those who have a greater burden or more complex needs. So these are all people that can be on your team to help you manage your symptoms. How are symptoms managed? First of all, if possible, avoid them. If they can't be avoided, there are behavioral interventions that can help. Beyond that, there are other non-pharmacologic interventions and pharmacologic interventions. So non-pharmacologic interventions mean ones that don't involve medications, and pharmacologic interventions are obviously ones that involve medications, whether they're from the pharmacy or over the counter. There are also interventional procedures. Cancer treatment itself helps to reduce symptoms in many cases. And then medical cannabis is another tool in the toolbox to help people with their symptom burden. So what do I mean when I say that symptoms can be avoided? Well, simple examples include staying hydrated and physically active as a way to avoid constipation. People with cancer-related pain who take pain medication on an empty stomach often get nauseated, and it's easy enough to tell them to always take their pain medications with a little bit of food. to coat their stomach, and that can make a big difference. People who are on chemotherapy are sometimes given recommendations by their oncology team to take certain anti-nausea medications to prevent nausea. And following those instructions can help prevent the unpleasant experience of feeling nauseated on top of everything else that you're experiencing. Behavioral interventions can be important. For instance, dietary interventions. There are certain conditions that people experience that a simple dietary intervention can make a big difference. Eating small, frequent meals helps people who feel nauseous or people who feel full quickly. People with pancreatic cancer or other abdominal malignancies can often feel a lot of bloating and gas. And so modifying the diet to remove foods that cause a lot of gas can make a big difference. For people who have fatigue, scheduling and prioritizing activities can make a big difference. So looking at your calendar for the week and looking at the things that you're wanting to do and the goals that you have, and then organizing your schedule so that you have the energy to do the things you want to do, and then rest time in between can make a big difference for treating fatigue. Mindfulness and meditation are interventions that can make a big difference for anxiety, for insomnia, for pain, for depression and anxiety. May have said that twice, but you get the idea. Also, exercise can be very helpful for fatigue. And anxiety and depression as well. So there are a lot of things that you can do just by modifying your behavior that can help. These are two of the apps that I often recommend that have wonderful relaxation techniques, breathing techniques, meditation, mindfulness, guided imagery. There are all these different types of practices to help people cope with almost any symptom through a really holistic approach. Other non-pharmacologic interventions are shown on this slide. Obviously, psychotherapy and counseling can be extremely helpful for anxiety and depression. Also for insomnia can be very, very helpful. Physical therapy can be very helpful for fatigue and for pain. A fan is sometimes a huge help for people who feel short of breath. That can make a big difference just to use a fan and let it be directed at your face and feel a breeze on your face can make a really big difference for people. Acupuncture has a lot of uses in cancer patients. Fatigue, anxiety, pain, insomnia, so many. Ice packs and heating pads are very helpful for pain. Acupressure bracelets can be very helpful for nausea. And then compression stockings are extremely useful for people who have lymphedema or any kind of generalized lower extremity swelling. Pharmacologic interventions are often needed for the symptoms that we need to manage when people are dealing with cancer and cancer treatment. And it's so important that people understand what their medications are and how they're meant to be taken. What's the effect that we're targeting with the medications? What are the potential side effects that you need to know about? What interactions might there be with other medicines or with foods? Is a medication needing to have its dose titrated? Is it something where you need to feed back to your team that you're getting some effect, but maybe need a greater effect, and therefore you might be told that the dose needs to be increased? Is the medication a medication that you can just stop if you feel like you don't need it anymore? There are some medications that really can make you feel quite sick if you stop them suddenly, and your healthcare provider will give you instructions on how to taper if you feel like you don't need that medication anymore. It's very important to organize your medications and to understand that some medications are meant to be taken on a schedule and others are meant to be just as needed. If they're meant to be on a schedule, then using a pill box can be very helpful. Often people will say, you know, that they just don't remember, did they take it or didn't they? And so if you have a pill box and you see that the pill's missing, then you know that you've most likely taken it. With medications that are taken as needed, I always recommend that people keep a log of how frequently they're taking it. It's hard to remember day to day how frequently and at what time. And also you can keep track of how much it's helped you, so that when you go back to whoever is providing you with this guidance on your symptoms, you can say what you took, how often you took it, and how helpful it was or wasn't. Interventional procedures are another resource for symptom management. Thoracentesis is a procedure where fluid that can accumulate around the lung space can be drained. People can have pain and shortness of breath from fluid accumulating there, and it can be drained, and that can improve the symptom quite a lot. Paracentesis is a similar procedure where fluid, if it accumulates in the belly, can be drained, and that can help with discomfort and feeling of nausea and fullness. Some people have difficulty even just getting around and doing their normal activities when their bellies are very distended. And those procedures are generally done at interventional radiology. There are also nerve blocks that are very helpful for pain that can be done in interventional radiology or by interventional pain specialists. Some people, because of cancer in the vertebral bodies, the vertebrae of the spine, they can get compression fractures, and those are very painful. So there are procedures, vertebroplasty or kyphoplasty, where medical cement is inserted into the area to help to try to relieve pain. There are also stents and other kind of more sophisticated pain plexus blocks that can be done, and those can make a big difference for people's quality of life and help use less medication. Cancer targeted treatments are also, you know, not only intended to help people live longer or help cure their cancer, but these treatments can also be used to manage symptoms. So sometimes people are advised to get radiation therapy because shrinking a tumor is gonna relieve pain. And it's a very effective way to relieve the pain, for instance, in bones, from bone cancer lesions going to bone, or if you have a kind of a mass somewhere that's causing pain, radiating it and making it shrink can make a big difference to quality of life. Sometimes people need to have surgery in order to remove a tumor or alleviate something that's causing pain, bloating, nausea, vomiting. And then chemotherapy, immunotherapy, targeted therapy, basically these treatments that so many patients get to try to reduce the burden of cancer and hopefully cure or at least live longer. Sometimes they also make a huge difference in people's pain or nausea or lack of appetite, fatigue. Sometimes, so in addition to causing some of these symptoms, these treatments also sometimes can dramatically reduce people's symptom burden. and make a big difference to them. Medical cannabis is something that it's a tool in the toolbox for symptom relief that's available to people in the state of Florida if they qualify, and other states around the country. Medical cannabis is available to people with a cancer diagnosis, and it can be very helpful for a number of different symptoms. You need to get certified for it. That's something that I do in my clinic, and can be done by other physicians out in the community. And once you have a medical cannabis card, you can go to a dispensary and get products. I always recommend that people go to the dispensary and ask for products that are targeting just one or two things, so they don't end up with a bag full of things that cost money, that they get confused about what's for what. But they come in different formulations. You can get cannabis as a tincture that goes under the tongue. There are capsules, there are edibles like gummies or chocolate. There's also topical products that can help with some things like joint pains. There are also products that you can vape or smoke, although I don't generally prescribe those to patients because I want their lungs to be as healthy as possible. But these cannabis products are very helpful for certain things. In my experience, they're most helpful for people who have poor appetite, and for people who need help with sleeping. They can also be very helpful for people with nausea, and hit or miss with people, for people who want it for pain. A lot of people ask to try cannabis for pain, and it's always worth a try. And sometimes it works and sometimes it doesn't. It's also helpful for people who just want something to help them relax if they feel anxious. So medical cannabis can be very helpful. There are also other things that contribute to people's symptom burden: financial worries, worries about transportation, worries about their caregivers, and also people who need more assistance with caregiving, people who are worried about their work, FMLA, disability paperwork, people who have anxieties about their treatment preferences being honored, if there were a time when they were unable to make decisions for themselves, worrying about who would make decisions for them. So helping people with advanced directives can give people peace of mind, which reduces their symptom burden. Dignity therapy is a process of basically interviewing a person, learning about their life history, the things that are important to them, things that are defining them in terms of their values, and then creating a document basically through an interview process with questions about their life. And then you produce a document that can then be shared with family. And dignity therapy can do a lot to help improve people's state of mind and reduce their symptom burden. And then, spiritual distress is a very important thing that we think about. And we have a wonderful chaplaincy program at Boca Regional, and there's a chaplain who works with our patients. There's been a dedicated chaplain last year and again this year, who's available and has a special interest in providing support to our cancer patients. So that's my presentation for today. I hope that I've given you a little more insight about symptom management, what the symptoms commonly are, how we approach assessing them, how we use the different tools in our tool bag to try to make symptoms better. Also, I've shared with you that there are a number of different people that might be on your team to help with symptom management. But when people have a particularly difficult or challenging symptom burden, if they need an individualized care plan for their symptom management, then our program is here at the Sandler building in Boca Raton. We see patients in person, by telemedicine, in the infusion room, to help to provide that care. Are there any questions?
Thank you, Dr. Jacobs. I have to say, you're probably the most beautiful tool that we have for symptom management.
Thank you so
Just
much.
listening to you talk about all the different things that you use and do on a daily basis, it really is very comforting. I'm sure everybody is agreeing with that. I don't see any questions. I think you covered everything so beautifully.
Thank you.
I want everyone to know on this presentation that our lectures are recorded. So if there's anyone that coworkers, family, or friends that you think would benefit from hearing what we have to offer here at our classic program, we're hoping there's been a little lapse in getting things on our website, but we're hoping that they'll be up soon. And you can let us know if you need anything. Looks like there's a question, Doctor.
Okay.
Oh, got a nice comment from Dr. Skelton.
Oh, thank you.
Thank you, Dr. Skelton.
With pleasure.
And so Lee will be she'll be sending out the link to our website along with the evaluation that she emails out to everyone. So you can check our website for programs that we've had in the past. Last year, Dr. Jacobs did one on medical cannabis. So if you want more information on that, that is definitely on our website at this point. And so I'd like everyone to know that we have lectures coming up in September. And on September 20th, one of our social workers Elsa Rayner will be presenting on successful sleep, which is part of what Dr. Jacobs spoke about today. September 22nd, we'll have our physician panel that will be presenting on prostate cancer. And September 27th, Marie Miranda, our oncology dietitian, will be speaking on nutrition and men's health. So let's see, there's something in the chat box. Another comment. Thanks very much for this presentation. It was very helpful and informative. Yes, it was. And we thank you, Dr. Jacobs, and we thank you for all the time and effort and research that you put into this. It was beautiful. Thank you so much. And thank you everyone for participating today.